One thing I think almost everybody would have to agree, hopefully, is that we want the regulatory function for Arkansans here in Arkansas. The federal government has given us that option to decide that we want to take care of our people. The federal government does not hesitate to step forward and regulate the health care for Arkansans.
We would rather control our own destiny. It didn't work real good in '57 when we defied the federal government, and I think that that was the main thing. And I wanted to talk to some folks that were involved in this in some other states and get their take on it to see if what I sort of believed was true, and it was. It's just simply the right thing to do.
What did you learn over the weekend that allowed you to vote today that you weren't ready on Friday?
Well, I just wanted to get some more information. I think it's, the states that have Republican governors are moving forward to set these exchanges up. So those were just key. Those were just some additional information that I got.
I think this is a step in the right direction. I think that this is something that we have worked very long and hard on. I think we started working on this last year. We actually amended the bill 10 times this side of the aisle, our Republican colleagues. And we had lengthy debates and discussions with them. And I felt that after amending the bill that many of them would vote for it, but not one voted for the bill even after we amended the bill. And that's really hard to digest, because one of the things around here, when you give a person your word should mean something.
And this may be a bad analogy, but we're birthing a kid and then we're turning it over to somebody else to raise. We still don't know the federal government, what they're going to do. They haven't written a lot of regulations. There are just way too many things up in the air to be able to address this at this time. I mean, it's just way too soon to be able to have to address this.
And now it's going to go to the full House. Will you be talking to people or voicing those concerns when it comes up again?
Well, I think you see it fell on party lines pretty much, and I would suspect you're going to see the same thing tomorrow. The key's going to be, are they going to be able to get, they have 54 Democrats, are they going to be able to get 51 votes? They're putting pressure on them to go ahead and implement this, and we'll see tomorrow.
And then what about that argument that at least the Arkansas would have some more control over this implementation? Did you think about that at all versus the federal government coming
Sure,
in?
that's always a consideration when the federal government's going to come in and take charge, but once again, the federal government is still in charge of it. I mean, even if we turn it over to Commissioner Bradford and they work on it, the federal government is still writing laws to change it, and a lot of the regulations haven't been written yet. So basically, it's still over to the federal government. I mean, they set it up, and they're going to make the decisions on how to regulate it. And obviously, as we saw with the healthcare debate, the states didn't have much influence over it.
The Republicans saw it as a form of a mandate from Obama, when it's really not a mandate from Obama. If we don't do something, the feds will step in and take over and put in place an exchange force. And we don't need that to happen. We need to control it ourselves. I think if we start on it now, we will have a clear, precise plan in place where we can take our time and not have to rush. If we come up on a deadline, certainly we're going to make some mistakes, and certainly the plan that we put in place might be flawed.